Welcome to Samba Samba. Enjoy the video.
You begin by assessing the scene and the injured person. Make sure you and the casualty are safe, now. Put on gloves, then check airway, breathing, circulation. That order matters because life threats must be controlled first. While you stabilize breathing, ask someone to call emergency services and bring the full kit. Once done, expose wounds only as necessary, control heavy bleeding with direct pressure, and use tourniquets only when recommended. This prevents worsening injury. Now you move to cleaning and dressing. Irrigate the wound with saline or antiseptic to reduce infection risk and pat dry with sterile gauze. Make sure to apply dressings firmly, but not so tight that you cut off circulation. Check fingers or toes after dressing. For suspected fractures, create a splint that immobilizes the joint above and below the break and secure it with tape or bandage. Once secured, reassess ABCs and monitor for shock. Keep the person warm and reassured. To finish, continuously monitor vitals and the treated area. Check pulse, breathing, and mental state every 5 to 10 minutes because conditions can deteriorate. Pack soiled materials into a sealed biohazard bag and restock your kit right away, noting expiry dates on medications and sterile supplies. If bleeding restarts or signs of infection appear, carefully remove dressings, reapply direct pressure, and prepare to transfer to professional care. This troubleshooting step prevents delays in escalation and keeps the casualty stable.
Thanks for watching. Consider subscribing if we helped you.